This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio. I made it here live. Can you imagine? Slip and slide and all kinds of stuff outside. Well, give me a call, 888-630-9625, 888-630-9625. Love to talk to you on any subject that you have in mind. Maybe it's the ice, and when you go out there and you slip, or the snow you've been shoveling, and it's been giving you all kinds of problems, particularly neck and shoulder pain. Yep, that's the time of the year. We get people coming in all the time and complaining, I hurt, and unfortunately it is a do-it-yourself program. It's one of those things that, you didn't take the time, or you compounded it, or you decided to take some aspirin and make things worse. Nevertheless, that's the topic of our show today. How appropriate, how timely, neck and shoulder pain. And to help me do that, unfortunately not in studio because he couldn't get out for slipping and sliding, Dr. Leonard Poe. Dr. Poe, you there?
I'm here.
Okay, good. Things are pretty nasty out your way, huh?
They are, yeah.
Well,
a little bit more out here, I think, than out your way, but it's nasty out there.
Well, that's the difference between Loudoun and Fairfax County. But nevertheless, I'm glad that you guys are in and safe, and all of you as well. Make sure that you watch it today. Be careful as you're going outside. That ice is going to be kind of nasty within the next hour or two. And, just err by letting the rain come in tonight and washing it away. They're salting as best they possibly can. The roads are at best passable, but at worst, you come off those ramps and so forth, it's going to be pretty ugly. But anyway, we're talking about those things that have accumulated over time in your neck and shoulders. The burden of your world sometimes ends up on your shoulders, and from all kinds of different types of things. Dr. Poe, this Wednesday evening you're going to be doing a program on neck and shoulder pain at the office at 7:30 p.m. on March 4th, this Wednesday evening, and it's specifically on the subject. So what I'd like to do is I'd like to talk about, all those different things that people put up with. They get up in the morning, their neck and shoulders hurt, they get in a hot shower, and they try to loosen it up, or they take an NSAID to try to relieve the pain, or a muscle relaxer, or they, at the end of the day at work, they feel, their whole body tighten up and their hands go numb, and a lot of that comes from the same type of situation. So take us through this matrix, if you will, of neck and shoulder problems. And, first, how do people know, when they're in pain? And the pain can be varied from dull to aching to sharp to burning to stabbing to you name it. The characteristics are varied and sometimes compounded on each other. But how do they know that, one, that it's a structural problem and it's not something else? And what are those something else's?
Well, a lot of times people are kind of intuitive about that, and when we're talking about if you've got numbness and tingling in the hands, if you've got any kind of pain going down the arms, or radiating down from the neck into the shoulder or anything like that, and that's going to be structural and based. And when we're talking about structure, we can either be talking about the bony components. We talk about the cervical spine, the vertebral bodies, disc herniations, things like that, those bony pieces, or it can be muscular in nature. The muscles can tighten down, they can start choking off arteries, start choking off nerves, and we get the same kind of thing. So it can be, one of those two things. People hold a lot of stress in that area. So there naturally is that other thing of it being a big stress component. And that, it's still, when we start trying to break things up into, chemical, emotional, structural, these things have a lot of overlap, and that emotional piece and that structural piece tend to overlap quite a bit when we talk about neck and shoulders.
We talk about this thing in our profession called spinal subluxation, and simply that means that the vertebrae, the bones of the spine, are not lined up properly. They're out of their normal position, and not grossly, they're just slightly. We're talking about millimetric disrelationships that cause an overstretch of the nerve roots of the neck or any place in the spine, or they cause a compression or irritation on those nerves. Subsequently, those nerves go places, and in the neck and shoulders, they go into the muscles, the trapezius muscles, the neck muscles, they go up to the back of the head, they go into the arms and hands and so forth. The premise of pinched nerve, as we know, is an old statement. Like a dentist says, cavity. You'll listen to a chiropractor and osteopath talk about subluxation, simply mean that there's an irritation. It doesn't answer the question why. How come it comes about? Why does it cause the irritation that it's said to do? There was an interesting study, and I'm going to talk about this just a little bit. National Institute of Health came out with a very, very broad base. I think it's something about 300 people that were involved in this thing, and they were looking at the outcomes relative to traditional allopathic medicine and complementary medicine, and that means the stuff that we do, and the different approaches to mechanical types of problems. And right now we're talking about mechanical pain, which really encompasses the greatest majority of anything that can happen into the neck and head, up to 95% of all those things that that cause people to take a medication or go do something drastic is coming from that. But what they saw was that in dealing with these conditions, manual treatment without drugs, without surgery, we're able to handle up over 75% as compared to less than 28% when it came to traditional allopathic treatment of any sort whatsoever across the board. And this was actually published in the Annals of Internal Medicine in 2012. Let's talk about that for a second. Why the differentiation? Why is one area of healthcare, conservative healthcare, more able to identify the underlying cause than somebody who has the MDD, if you will?
Well, and what we talk about, as very specifically for us as chiropractors, but what we're talking about doing is actually getting our hands on someone and actually reversing those mechanical changes. If we're talking about subluxations, which is that partial dislocation, not a full luxation, but just a partial one, and the bone has moved millimetrically, well, we move the bone back millimetrically. And that's really, you can't just, take an NSAID or, take medication. It'll dull the pain for you, but it doesn't change the mechanics. And that's why what we do is just so, far-reaching and so much more effective, because we're actually reversing those mechanical changes. And then you get in there, you do the muscle work, you do the rehab, you retrain it, you do a lot of muscular re-education, get it strong again, get it limber, and you feel better.
What do you say?
Much more lasting change than anything else.
What do you say to the patient, though, when they come in and they say, "Doc, my neck hurts because I have arthritis, and I don't care, nothing's going to change that. My doctor told me that I'm stuck with that for the rest of my life."
I tell them to find a new doctor.
No,
just because you listen. The reason why you get arthritis is because we're talking about osteoarthritis here, not any of the erosive arthritis and anything else. When we're talking about osteoarthritis, it's because those joints aren't moving in their proper planes anymore, and the spaces are getting broken down because they're subluxated. So, are you going to reverse a lot of bone degeneration? No, but it's not the bone degeneration that's causing the pain. It's because it's still mechanically out of place. So you can put it back. You can get those spaces opened back up where the arteries are going through, where the nerves are going through, and you still get rid of a lot of the pain.
So when you're talking,
not all of the pain.
When you're talking about degenerative problems, you're talking about degenerative disease, arthritis. That's what we're talking about. Arthros meaning joint, itis, inflammatory reaction that causes a breakdown in the joint. There is a why is that, and as you said, it starts with the mechanical disrelationship of a joint space. We're talking about the joints of the neck right now. So you can't get an arthritic degeneration unless there is misalignment and also a underlying biochemical problem. So is there a chance that when a patient comes in with neck pain due to an arthritic type of condition, that you can stop it, but also is there a chance of reversal?
There is a chance for reversal. And you got to get rid of the inflammatory, why can't your body keep up with the inflammatory component to begin with? And that's when, we talk about these glands a lot, but that comes back to the adrenal glands. And, the fact of the matter is that for most people, those glands are not working very well anymore because we're too stressed out. And so there needs to be two things. We need to look at, what's going on in life? Why are we not able to handle the amount of stress, whether it's physical, it's emotional, it's, whatever it is? What are those things? Why is the body not handling? How do we get the body to support it? How do we support the body a little bit better to keep up with the daily stressors in our lives? And then we've got to rehab the joint space. If you can do those things, then, you can get it much, much better. You got to look at, but it still doesn't answer the why behind it. Well, how did it get that way in the first place? Is that an ergonomic issue at work? Is it a trauma issue? Is it, you're commuting an hour every day and your shoulders are all scrunched up, you're staring at a computer for 8 hours? You still have to come back and answer that question, how did we get here in the first place?
My guest today, Dr. Leonard Poe, your presenter, your host at the Roselle Center for Healing this Wednesday, March the 4th, 7:30 p.m. Love to have you as our guest. All you need to do is call us at 703-698-7117, 703-698-7117. Remember, all the classes that we have in-house are a gift. They're free lectures. They're free presentations to you. And all you have to do is call. We do need a reservation, so call us at 703-698-7117. And if you have a question for Dr. Poe today or anything else off or on the subject, 888-630-9625. That's 888-630-9625. Love to talk to you, and we'll see if we can put the fire out for you and make your head and neck and shoulders turn the way they're supposed to, or any other thing that you'd like to discuss with us. Dr. Poe, let's talk a little bit more about how these things happen, because the causes of neck pain can be anything from trauma-induced, a car accident, a little fender bender. With most people don't realize how little it takes in an unprepared situation. People who sleep on the couch with their head locked down in position, overstraining the muscles, ultimately mechanically disturbing the motion of the neck. Or, you see people sitting there and all of a sudden they go into whiplash when they're sleeping. I mean, their head just kind of drops down real quickly, very suddenly. Or, how they position themselves in any type of mechanical presentation, ergonomics in their workplace, looking from one side to the other. So let's talk a little bit about this, the compounded effects of life, from what they do, what they don't do, and so forth. Typical patient, never been involved in an accident. What do they look like? They come in, they have pain. How do you unveil the why is that, if you will?
No, usually the patient will tell you that in the first 5 minutes of the conversation, what they do, typically what you see, how many of us are just sitting at a desk all day long looking at a computer typing most of the day? The vast majority. How many people, especially in this area, are, commuting large distances every day? Those are it's not, every once in a while, it's a big trauma. We have those car accidents, we have those falls, we have those old sports injuries. But for most of us, it's what we call micro-trauma. It's just those daily things. And, it's so easy to just, in talking with someone, to start identifying all those daily things that just seem, individually, they're little, that alone shouldn't do it, but there's lots of those little alones that shouldn't do it throughout the day. And you start adding all those things up, and they start to be, big things every day.
So real quick question. We're coming up to a break, but we're going to end with this because we're going to pick up on it. Shoulder problems, shoulder pain, frozen shoulders, tendonitis, strains, that type of thing, dislocations even. How many of those come from a neck problem?
Vast majority.
We're going to talk about that when we come back after some important messages. That's the truth. So many of these problems start in the neck, and we wonder where they came from. You can't lift your arms above your head anymore. You can't reach without pain. You can't turn over in bed without pulling yourself into position because your body hurts. Not a good thing. Not a good thing at all. And when you're out shoveling snow, it even makes it worse. Don't go away. We'll be right back. You're listening to Dr. Tom Roselle Live. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. You name the subject. We'll go over it. Not a problem. You can be off topic if you'd like. Nevertheless, my guest today, Dr. Leonard Poe, he's going to be your host, your presenter at the Roselle Center for Healing this Wednesday evening, the 4th of the month, 4th of March. Wow. And the birds aren't here yet, Jeff. Where are they? Give us a call at 703-698-7117, 703-698-7117. Tell my staff you'd like to attend. These presentations are no charge, our gift to you. So if you have neck and shoulder pain, doesn't go away, your doc's told you had arthritis, this is an opportunity to figure it out, to see what really can be done. Don't put it off anymore unless, one of my favorite shows, Dr. Poe, you still there?
I'm still here.
You ever watch Person of Interest, or you go to bed by then?
I'm probably in bed by then.
Okay, so you got to TiVo this thing. It's very cool. It's about the supercomputer, but we won't get into that. But anyway, there's this guy who designed this thing, and he moves like a robot. I mean, his neck doesn't move. He just kind of moves his whole body from side to side. And that's what happens with people, is they put up with things. They lose the capacity to function, and they don't think they're having a problem because they've adapted their whole body style. I know you know what I'm talking about. What's the problem with that?
Well, it's obviously you're not fixing the problem, and that's the biggest problem with it. I mean, you're just going to end up compensating and causing more problems elsewhere down the line. And that's probably the biggest thing, is people get into this, get stuck in this place of compensation. So it's not, and then you're going from having a left shoulder problem, and now we have a right hip problem because it's trying to, balance you out a little bit. And, it's a common thing that we see. Most of the stuff I see anyway is, compensatory patterns. I mean, wouldn't you say?
Absolutely. I mean, people put up with, adapt to, they set aside, as long as I don't have to do this, I'm okay. Well, they've given up the majority of their life.
Yeah.
I've had patients that come in and say, if as long as I don't go outside and rough and tumble with my children outside, I'm okay. I can go for walks with them. I said, and that's okay with you? That's really something that, I have to sleep in a chair. I'm one of those lazy boy recliners or whatever they are. I can't lay in bed because it hurts too much to lay flat. My neck hurts. My hands go numb. That's not okay. Those are called symptoms that are not acceptable to be dealt with. So when you have a patient like that, and they're coming in and they have all kinds of problematic situations, there's a nerve that goes into the chest, in the front chest wall. It's called the anterior thoracic nerve, or the long thoracic nerve, and often it can simulate a heart attack. So, and it's coming from the neck. Walk us through, if you will. We've got a few minutes before we have to break at the bottom of the hour. To walk us through the mechanics, the neurology of this neck mechanism, and really truly how it affects, because many of our listeners say, yeah, my neck hurts, my shoulders hurt, but what's that got to do with anything? They still think it's an arthritic condition, but we're talking about a neurological implication here. What does all this really look like in fact?
Well, when you're talking about from a neurological standpoint, I mean, all the muscles in the, I won't say all of them, but yeah, all the shoulder, all the muscles in the shoulder and the chest and the arms, I mean, they're all controlled neurologically from nerves exiting out the neck. So even if you've got a forearm problem, you've got an elbow problem, you've got, something like elbow tendonitis, for example. I mean, that's still being heavily mediated, and because of problems coming from the neck, because if the motor function isn't there, if the nerves can't properly tone and control the muscles in the arm, then they don't move in the coordination that they're supposed to, and then they're no longer moving in their joint planes properly, and then you build up friction, and you get that itis, you get the inflammatory problem, and then you've got elbow tendonitis. But same thing in any of them, and it's all about the nerves, the brain being able to control the muscles properly, and that's just not happening. And then you've got other things, you mentioned like the chest wall. You've got muscles, and this is one that I see a lot. People, they're having chest pain, and they're worried about it being a heart attack. You've ruled out, okay, it's not a heart attack. There's no reason for that. And it's the serratus anterior muscle. It's one of those muscles that come in and it grips at the rib cage, and it helps with breathing, it helps with chest expansion. But if it's going into spasm and it's biting at you, it's gonna it's going to pull at those ribs, and you're going to get pain across the whole, the whole rib cage, and it'll feel like my chest is being squeezed. It hurts. So you see things like that a lot, and then there's also nerves that come out, the bottom of the skull. You got things like the phrenic nerve, for example, which helps with breathing. You've got the vagus nerve, which does a whole lot. So there's the neurology. If the neck's not right, it's far-reaching.
It's important to really understand the electrical circuits, if you will, the term that I like to use as an analogy when it comes to that mechanism, because everything from about 2/3 of the lower portion of the neck down to the upper portion of the back controls the arms, the hands, the upper chest, and so forth. And all the things you're talking about, the serratus andicus that you just talked about, that's the muscle that holds the shoulder blade flat. Matter of fact, if you've ever seen anybody that has a shoulder blade that's winging backwards, sometimes both sides, but one side generally if they've hurt themselves, you're talking about the nerve that facilitates that muscle and is no longer firing, and it came from its origin in the neck, not just directly to the muscle. You can hurt muscles, but they have to be traumatically induced, or you have to have another muscle that's not firing properly that causes another muscle either shut down or be facilitated a little bit more than it normally would be. That's called spasm. But it's rare that you see true spasmodic type of conditions. And whether it's what we're talking about right now or a neck that just locks up, you see patients, and we have several of them in the office. Dr. Poe, you treat them, so do I, where their neck is locked in a certain position. We call that torticollis. And if they have spasmodic, it means that they're going back and forth into that bending position of their neck. We're going to talk a lot more about that when we come back. Our number here is 888-630-9625. We're going to take several of your calls when we come back after some very, very important messages. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's how you find me here. And love to invite you to go to our website. Go to rosellecare.com, ROSELLECARE.com. Take a look around. And by the way, we have a listing of all of our upcoming classes, and you're welcome to attend anytime that you'd like to. These are our gift to you. This Wednesday evening, Dr. Leonard Poe will be your host, your presenter, and he's going to be talking about the subject that we're kind of chatting about today, neck and shoulder pain. If you've suffered with it, there's no reason. You can always make it a whole lot better. The odds are in your favor if you get away from the medications and so forth. There's very few people that actually need to go that route as long as you're willing to do what's necessary. Dr. Poe, you still with me?
I think so. You got me?
Yep. I think after all, we're going back and forth with numbers. Let's go to the phones to begin with. Shirley, how can we help you? Thank you for calling.
Dr. Poe and Dr. Roselle, so nice to talk to you. I have two questions, and I will be as short as I can. The first one is I have been diagnosed by 3 orthopedics, bone-on-bone, osteoarthritis, very, very sore, stiff, very hard to walk. Okay, the second question is my head. My head at times feels real heavy and tight to the point when I lean over sometimes, I feel like I'm going to tilt over. So I was wondering, with you all talking about nerve and bone and stuff, did my arthritis, would that have anything to do with this condition in my head? And do I have other alternatives rather than having this terrible surgery on my knees?
Okay, so we're talking about your knees, Shirley. Is that correct?
Yes.
Okay, and so you're leaning forward, your knees are killing you, you're bone on bone. It depends. There's a lot of different things that are out there, from natural therapeutics, dietary changes, acupuncture, low-energy light laser, working on the lower portion of the spine because that's where the nerves come from that go to the knees and to the legs. And when your muscles, your buttocks muscles aren't firing, your thigh muscles aren't firing the way they're supposed to, you're going to lean forward. There's nothing holding you back. That's part of the problem. Your gluteus muscles, your butt muscles are what holds you upright, and that in conjunction with your low back muscles. But they also have the same neurological influence that goes to everything in the lower extremity. So the question becomes, how far advanced are you, and can you get some relief before you go into surgery?
It's bone on bone, they say, the cartilage, and they gave me those shots, Senvex, I'm probably not pronouncing it correctly. That did not do anything. They're very sore and stiff, and I do have pain. And like I said, with my head feels very tight and heavy a lot. And I was just wondering, did the head have anything to do with the legs?
Yes, absolutely. Your everything starts from above down, Shirley. Oh. And if, for example, if you break your neck, you're paralyzed, right? You can't move anything from that point down. Mm-hmm. So, but you can have a small irritation on the nerve or the spinal cord, and it can affect the lower portion of your body as well. And you're not going to work, and all of a sudden everything starts breaking down. So the short answer to that is yes, absolutely. But as far as the one defining question, can you bend your knees at all, or are you walking around very stiff-legged?
I can bend them.
Okay. Can you go upstairs without too much pain?
No, I can't. I go one step at a time.
Okay. Again, I would have to take a look, and Dr. Poe and I would have to look at your X-rays or your MRIs to determine it. And it has a lot to do with, even though that they're bone on bone, if you can get the inflammation down, if you can get the muscles strong, if you can put the body into an alkaline situation, you can perhaps put the surgery off for a long period of time. But if the joints are destroyed where they've actually had erosion into the joint spaces themselves, then you're looking at surgery.
Okay.
Okay?
All right.
So if we can help you, stop by with the films, we can take a look at it. But
what about the head? The
head definitely something can be done there.
Okay.
Okay?
Well, thank you. Have a good day.
You too, Shirley. 888-630-9625. Dr. Poe, you could have stepped on my parade there.
No, Shirley, Shirley's is kind of a cautionary tale that the thing that we can't fix, we're always talking about, let's fix it. The thing that we can't fix is, and nobody can, is when that cartilage is destroyed. It's avascular, it doesn't regenerate. I mean, that's really the hard thing. So when it's completely gone, you're not getting it back, and that's a tough place to be. So, you fix these things before you get to that point.
Yeah, and I mean, preempting that situation, what you're dealing with, once it gets to the place where it's gone, in a perfect world, if you could isolate it and you could do a lot of different things. I mean, we have some friends, somebody that doctor that you respect, who strapped a laser onto his knees every night while he was sleeping and kept it on all night long, and he got cartilage back. But he has the capacity to treat himself and to do those things. Unfortunately, most people don't have that, and it's extraordinarily expensive. But the sounds of this type of thing, it's way too late. As you said, it has to be preempted. It has to be done when the discomfort starts.
Yeah, and especially when we're talking about, the spinal discs. I mean, once those are gone, it's where you're getting into a really, really bad situation. That's why it's so important. You don't wait till these things are like that. I'm not saying that it's anybody's fault, but that's when you start noticing things aren't right. When you have those little moments of pain or those little moments of discomfort. That's when, and it's so easy to get to it and fix it at that point and avert problems way down the road. But when you get to it early like that and you fix it then, you fix the mechanics. You save yourself a lot of hardship down the way.
And here's an interesting twist on this that most people aren't aware of, is that they go to the physician and they put them on NSAIDs, a non-steroidal anti-inflammatory, Advil, Motrin, that type of thing, and then they go to the heavy-duty guys like Celebrex. It makes it worse. It actually causes the joint space to degenerate faster.
Well, that and, pain is telling you that something's wrong. And when we just cover it up and we keep doing things that we're doing that got us in that situation in the first place, then you break down the joint space even more, and you don't know you're hurting yourself then. And so, yeah, sure, you make it a lot worse.
Yeah, it's unfortunate that we're not trained well to take care of ourselves. We're born with function, and then life happens. We have injury, our diets stink, and we're under stress all the time, and then pretty soon we end up with these symptoms. Unfortunately, in traditional care, when we have a symptom, we want to blunt the symptom, thinking that we're going to resolve the underlying imbalance, particularly as we're talking about neck and shoulder pain. And as we said, this Wednesday evening, we'd like to invite you. Please be our guest at the Roselle Center for Healing. Dr. Leonard Poe will be your host, your presenter, and he's going to be talking about this subject intimately. We're going to get into detail. You have the capacity, you have the opportunity perhaps to get off of all the junk that you've been on for the first time if you're willing to make some significant shifts in what you do and how you handle your life. So much of this is lifestyle. Dr. Poe, let's go to the phones. I want to get back, and I want to talk to you about lifestyle and how this really affects these neck and shoulder problems that we're having and why people put up with them, and then they find themselves in this Twix that we just talked about. Chuck, thank you for holding. How can we help you, sir?
Yes, I wanted to know if chiropractic can help a tremor in the left hand, if that's a pinched nerve or anything like that.
How long has it been there, Chuck? Chuck?
Come again?
How long has the problem been in your left hand?
About a half a year.
Okay. Have you had an injury? Have you had any kind of accidents?
In the past, yes, but not like more than 10 years ago, yes.
Okay. 10 years can build up over a long period of time and then cause you things. Is it an intention tremor, meaning that when you go to grab something, that's when you feel it, or is it just a gross tremor that anytime you put your hand out, it starts trembling?
It happens when I have it resting still. If I put it in motion to do something, it doesn't tremor, but when I have it resting still, it tremors.
Okay. Have you had it evaluated at all?
No.
Okay, so let me give you the short answer. The short answer is maybe. And it depends on history, depends on if there's any trauma. The left hand is being affected, so you have to begin to rule out upper neurological problems, brainstem types of conditions. You would rule out the localized type of conditions where the nerve itself on the left side is being irritated. So you would check the wrist, you check the elbow, you check the shoulder, you check the neck. The further upstream that you can identify the problem, the more effective the resolution becomes. There's ways of finding out whether or not it might be a upper neurological problem. In this situation, what we're talking about is something that may affect the mitochondria. We've talked about that several times over the past weeks. Mitochondria, these little energy cells within the nervous system, and if there's been any trauma to the skull, to the neck, or stress, long-term accumulated stress, something that affects that old friend of ours that we talk about, the HPA axis, the hypothalamus pituitary adrenal, then you begin to see these things. There's specific nutrient bases, but you have to know what they are. You have to identify it. So the short answer, going back to what I said, Chuck, is possibly. But you have to identify what the condition is. If it's structural in its origin, yes, absolutely it can be taken care of. If it's neurological, due to trauma or impact, you treat the areas that have been traumatized, but then you also have to support it biochemically, and that may be with brain chemistries, nutritional patterns, amino acids, that sort of thing, even something as simple as coenzyme Q10 at very high levels and some other things of that nature. So we'd have to know much more about it from an examination point of view, but there's a good possibility, yes, particularly at 6 months old, and you never had it before. But the fact that you've had some injury and perhaps some other things that you hadn't even thought about may impact this thing. So, Chuck, if we can help you, please give us a call. And come on down to the program on Wednesday evening. Talk to Dr. Poe. Happy to go through this a little bit more. Dr. Poe.
Yes, Chuck, those are, that's something like a tremor. Those are things you don't ignore. It's, like blood in the urine, blood in the stool. Those things are never good. Tremors are never good. A little tremor is not okay. It's something you want to check, and you want to see, well, why exactly are you getting that tremor? Those are things you don't ignore those things. You find out what it is, so you can deal with it properly. This is one of those things you definitely get checked out.
888-630-9625. That's 888-630-9625. Love to talk to you. My guest, Dr. Leonard Poe, will be your host, your presenter this Wednesday at the Roselle Center for Healing. Dr. Poe is going to be talking about neck and shoulder pain. If you really want to get to the underlying process of what's causing this thing and how to fix it before it's way too late, before you get to a place where you're only left with one option, and that's surgery and replacement of parts. Not the best thing that you want to do, but sometimes you get to that place because it's been a lifestyle. It's been over the years. You've eaten the things that you shouldn't have been eating, and it causes an inflammatory cascade called acid, and it eats up the joint space, and you continue hurting because you're not fixed mechanically. So if you're not fixed mechanically, it's like, Dr. Poe, I often use the analogy of a house. You have a house, second, third floor, the window's cracked. And it's cracking because the footer's breaking down. But we don't understand that. So what we do is we replace the window. Problem is the window cracks again, and now the frame's breaking down. You got to fix the footer. In this type of situation, you have to fix the cause.
Mm-hmm. I don't disagree with you.
So this Wednesday, you're going to get into the details, the intimacies of this. Let's talk about a patient. I want to go back to the medications that they take and why they cause the problem to progress. You know, somebody who's been on one of these NSAIDs, we've talked about it many times on the program, that it makes the joint spaces worse. And patients say, well, it makes the pain go away. How can we talk to our patients and let them know that it makes it worse and it's not a good thing?
Well, that's where, okay, what is the medication for? Okay, is the medication to correct the problem, correct the joint, or is the medication for pain management? I mean, that's the real question. That's the question you need to ask your doctor. What exactly is this medication going to do for it? If we're just correcting pain, then you're in pain management, but you're not really fixing the problem. I mean, that's really what it comes down to. What is this designed to do? And medications are not designed to fix mechanical problems. That's the bottom line. Now, you know, when we talk about quality of life, and I can't even get out of bed, you know, maybe then, you know, to give you some time to actually get the thing fixed. But it's like you said, in the long run, you have to understand that things like cortisone shots, things like, you know, NSAIDs, things that are going to block the sulfite receptor, those things are bad long term. They're going to make it worse.
They make it much worse. Let's go to the phones. Marla, how can we help you? Thank you for calling in today.
Thank you for taking my call. I was listening to you talk about neck pain and the nerve pain, and my neck gets stiff. My arms get numb. My fingertips will tingle, and I can't turn my neck all the way. I had an X-ray done several years back, and the doctor said he'd never seen a neck as straight as mine is. But this morning I woke up. You know, I wake up a lot of times with my arms kind of numb or tingling, and this morning I woke up because my hand and my couple of my fingers were really painful. And I just thought this was something I was going to have to deal with until I heard you talking.
No, there's a whole lot that you can do.
No,
and
you can fix it.
What do I do?
You're out in Martinsburg, is that correct?
Yes.
Okay. So I need to do some research for you, but you need to see someone who does the kind of work that we do, and I'm happy to make a referral for you. So if you send me a note on our website at rosellecare.com,
okay.
I'll tell you exactly who I would go to. I'll do the research. I'll find out who's out there and let you know who they are. But the fact that you have a perfectly straight neck, mechanically that is not okay. Your neck should be a C-shaped curve opening to the back. That handles the weight of the head. It handles the balance of your whole body and protects the spinal cord. Marla, send me a note. I'll get it done for you. We take a break. We'll be right back.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Neck and Shoulder Pain with Dr. Leonard Poe on Wednesday, March 4th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find us here in studio. And how you find us when we're not on the microphone is 703-698-7117. That's how you register for this Wednesday evening's class on neck and shoulder pain. Dr. Leonard Poe, your presenter, your host, our guest today on the show. We're talking about all those things that make you hurt, that make you have to say, I just can't do anything, can't lift my arms above my head, even losing grip, even the capacity to be able to do things. Dr. Poe, we're going to take one more call, and then we're going to ask you why they should come to talk to you. George, how can we help you, sir?
Yes, you mentioned a little earlier about the neurologically in the neck sometimes connect with shoulder pains. I slightly wrenched my shoulder shoveling snow last week, banged against the retainer wall in my driveway, and with stretching exercises the pain's going away. But what happens occasionally when I put my arm up in a certain route, a nerve telegraphs up to the lower part of my ear. It's not it's just a pinging pain in the lower forward part of my ear canal.
Dr. Poe.
That could be several different things. Probably from the upper cervical nerves. Does it only happen with physical motion?
Yes, that's right. It only hurts. It's not like an earache with the sinus back up or anything like that. Or
I would look at a couple different things, and maybe some prior TMJ issues, but probably some of those upper cervical nerves in there as well. You're getting some pulling in there, and you're probably maybe pitching off some of the cranial nerves of the ear.
George, what'd you hit? You said you fell into something.
Well, no, my house sits up on an embankment, and my driveway is at street level, and so I was shoveling snow in my driveway, but there's a retainer wall, and I slightly slipped sideways when I was pitching some snow, and slightly slipped and banged my shoulder against the retainer wall. It's a brick retainer wall.
Okay, so what you could have occurred in a couple different ways. One is a shoulder strain where you just kind of mechanically traumatize the muscle. But the other thing is anytime you hit anything. Now think about this neck and shoulder mechanism. You got this head sits on a small little pedestal called your neck, and as soon as you hit it, whether it can be a 5 or 6 or 10 pound impact, it's enough if your neck moves to the side, one side or the other, you can cause the nerve to be irritated. So now your shoulder's coming back, you're getting range of motion, but you still have a vertebrae that's not in its normal alignment that's causing that tweaking, if you will, that pain to occur. So every time you mechanically raise your arms, you're causing a compromise to that area. So it's telling you that there's something more there that wasn't there before, and it's mechanical. And it's something that has to be done, because if you allow it to stack over a period of time, unfortunately, if it doesn't go away, it's going to get worse. And you don't want to cover it up. What I would do is I would use hot, moist heat on it. Moist heat, not an electrical pad or anything like that. Move your neck from side to side, rotate to the right, rotate to the left, rotate back, put your ear to right shoulder, your ear to the other shoulder, and stretch. But if it's still there after you do that and it doesn't improve for a couple of days, you got a problem that needs to be looked at, and it can be fixed. It can be fixed pretty rapidly. So let us know. Come on down to the class Wednesday night. You can ask more specific questions. We'll ask you more things. And, George, thank you very much for your phone call. Appreciate it. Dr. Poe, let's talk about the class. Tell us what's going to happen and what people can expect by coming this Wednesday.
Well, it's, a lot of phone calls we've gotten today. If you've got any of these problems, if you've got things like tremors, or you've got things like numbness or tingling in your hands, or you mechanically move the shoulder and you get pinging in your ear, those are big telltale signs that something's wrong. If you got anything like that, please come to the class so you can, kind of learn about it, and I can help give you some information and kind of figure out, well, why is that? What's really going on? If you've had mild neck pain, if you've had, mild shoulder pain or headaches or anything like that, to get those things fixed now. A little bit is not okay. A little bit adds up over time. It's kind of like a 401k. And you want to get in and you want to fix those things very, very early. The earlier, the easier it is, the less intervention you need, but you've got to start somewhere. So, wherever you are in that spectrum, we'll break down the head, the neck, the shoulder, and help you figure out, where are you and what do you need to do?
The longer people watch things, and I love that expression in the traditional community. Well, let's watch it. Let's see what happens. What are you watching? You're watching for this thing to become a monster, or do you want to handle it when it's, in its infancy stage? Then you have the ability to change something permanently once and for all. But if you've been kind of playing with this thing, and you've been medicating it, and you've been dealing with it, you're looking at degenerative disease. You're looking at the ongoing process.
That road to anything, whether you're talking about degenerative disc disease, whether you're talking about diabetes, whatever it is, it's a long road. And the sooner you turn off that road and start to walk back the opposite way, the easier it is. I mean, once you wait till anything pathological is full-blown, then we're talking about serious intervention. So you get those things early on. This is going to be a great class. Do not put up with neck and shoulder pain. Truly, it's one of the worst things you can happen. Ask May what happens when you get your head busted on a pillar and you're in a car accident. It affects your entire body. Fortunately, I have great doctors around me taking great care of my problems. We want to do the same for you. Join us this Wednesday evening, 7:30 p.m. Your host, Dr. Leonard Poe. See you then. Bye.